Okay, welcome back to Pain to Par, where we turn physical setbacks into comebacks so you can get back to what you love. If you've been following me for any time, for me, that is golf. And, we're now in April, so this is a couple days late because I'm supposed to do this at the end of the week. And so this is really my week 5 update. But we're getting close to golf season, and there's been some progress. So, as the title of the video says, my sciatic is gone. So that's really cool. So, in today's video, I'm going to talk about my week 5 update of the intensive 12-week program to start to heal degenerative disc disease, sciatic pain, and hip arthritis. Update on the exercises I'm doing, and review of some of the supplements. Because, like I said, this is pretty pivotal for me. That the flame up, or what I call flare up, of sciatic is gone. So I haven't experienced anything like that in at least 2 weeks. So, I still feel there's some sciatic nerve adhesion, I think, because it feels a little tight in there. And it really feels like a string going from my hip down to my shin. But I don't have that burning sensation anymore in my shin. And even I used to feel a bit of numbness in the shins, on both, actually, and that's kind of subsided too. So, I think overall there's some really good progress, and so we're going to jump into the super fancy PowerPoint presentation, and I'm going to take you through the update. Let's dive in. Okay, so first things first, I always start with a review of what this 12-week program is. We are now in month 2, week 5. It's a 3-month program, focused predominantly on robotic laser spinal decompression, coupled with physical therapy, exercises, supplementation, and weekly consults with Dr. Zielonka, which includes most of the time a chiropractic adjustment, and just a discussion, which could lead to other treatments. I'm now in what's called month 2, which is week 5. So I've dropped from 3 times a week doing the RLD sessions to twice a week. And I've already met with my physical therapist, so I have some new exercises that I'm going to talk about today. And yeah, overall, it's moving, right? As I said, the really cool thing is, yeah, first let's, I'm, as stated, I've done 2 sessions. I've moved now from going from 3 sessions down to 2 a week, and then in month 3, I'll go down to 1. I met with my physical therapist to get the new exercises this week, so that's good. And I'm managing to do my exercises every morning. So that is, stretches. It's predominantly stretches and some strength exercises, really focused around that whole pelvic area, the hips, the glutes, and I think it's made a huge impact. Okay, status update. Like I said, sciatic pain is gone. It's crazy. I used to be sitting in a chair and it would start to burn and it wouldn't subside for 10, 15 minutes, and I would have to do all kinds of contortions. I think people who get sciatic pain really start to monkey around with positions and doing different things, trying to relieve any stress on the sciatic nerve. And so I haven't had to do that for over 2 weeks. So it's really cool. And I think it's really just the aggregation of everything, right? This is really a holistic thing. There's the RLD sessions, I think, are really helping. Obviously, supplementation is assists the exercises. As the one thing I've learned going through this process is, if there is an imbalance, a muscle imbalance, you really need to address that if you hope to have long-term success and relief. So no sciatic pain, and I tested that. So this morning I was at the gym and I did 30 minutes on the treadmill, just walking, but I walked backwards because to try to get the counter motion, right? So if you're walking this way and when you're walking on the ground is not moving. So there is a natural friction. When you're on a treadmill, there is less friction. So the way to get that friction is to turn around and walk in the different direction the the treadmill belt is going. So I did that for 30 minutes, and honestly, I wasn't hitchety, and it was mildly sore after, but that's 30 minutes of continuous walking, which I haven't done for quite a while, and it's great because I'm probably a month away from being able to actually get onto a golf course. So yeah, and then the rest of the stuff, look, it is funny because I was talking with Dr. Zielonka about this, and he's like, Dan, you're doing something really rare in that you're documenting your week to week progress. And this isn't the type of treatment that really relates well to week. You're not going to see, it's actually going to be a lot of ups and downs. And I can start to feel that. Like, as far as the hip pain, I still have hip socket pain, but like the exercises I'm doing are really targeting the glute medius and the glute max and the adductors and abductors. So it's going to be painful, and I still have a fair amount of lower back pain. Like, it's degenerative disc disease, and I've spent my whole life sitting down at a desk and twisting myself to play golf. So I'm sure it's going to take a while. So it's not the type of thing where every week I'll be like, oh, I'm up to 4.2 inches. That's not the key here. Obviously, the goal of this is to document how it's going, what's working, what's not, and how do I get back to doing something I love like golf. So for me, the progress of the sciatic flare-ups gone is just humongous, and I feel great about it. And I would encourage anyone who's going through sciatic pain to really go talk to a practitioner in their city that handles this robotic laser spinal decompression. And in Ottawa, that's Dr. Zielonka at his clinic, and in different clinics around Canada and around the world, there's likely someone in your city that does it. And it's very similar to just spinal decompression, except that it is with the additional laser. Okay. So just quickly, I want to go over some of the things I'm taking. So I take a supplement called Nerve Regen Max. It is predominantly, I was told it's got like, oh, it's so small. Turmeric, bentodiamine. Ideally, I was told this is really to help replenish the discs. So that's Nerve Regen Max, OA Max. These are both by Core Science, which is the brand that Dr. Zielonka uses. This one is really it's a global kind of osteoarthritis type of supplement. Has glucosamine in it, MSM, B3, boswellia, turmeric, hyaluronic acid, zinc, copper. So these are all just like this one. OA Max is really just a joint healthy supplement. I also take magnesium by bisglycinate, K2, D3, and fish oil with EPA and DHA. And those are all by a company called Cytomatrix, just high quality stuff there. And so that, again, this isn't to say this is what you should be doing. This is to say, I've managed through a series of exercises, treatment, supplementation to effectively relieve one of the most nagging issues that I was suffering, which was a sciatic pain that was flaring up. And that's now gone, literally. I still really can't believe it, but it is. Okay, so that's supplements, treatments. In terms of exercises, I still do a set of stretches every morning, which include what you see here: single knee to chest, knee across chest, figure 4 to chest, trunk rotations. And so I do trunk rotations and supine supine trunk rotations and thoracic spine type stretches. And Then, working on the hamstrings, quads, and the QL. So really trying to stretch in and around all the major areas that could contribute to uh, the pain and the restriction I'm feeling. And I'm starting to experiment more with fascia releases and fascia stretching. So I follow a woman called Rafa Movement. I think she's got both a YouTube, Instagram, and TikTok channel, and she's got some amazing stuff. So yeah, as I get progress with those, I'll let you know. In terms of strength, there was a whole bunch of exercises I showed before, but they've changed since. Except I've been giving new exercises from the physical therapist, but I've kept doing the one-legged bridge dips for my one side that is, my left side, which is where I have my arthritis, because it just hits the glute med so well. Then these are the new exercises, and I wasn't. They were kind of shown to me, so I had to go find them online. So I'll link to them in the description. First is a 4-point hip circle. So you're on all fours and you're moving your leg up and in a circle. It's kind of like a hip hydrant as well. It's really just to mobilize the entire hip socket. Side bridge dips. So that's to work on the glute med, and lateral banded walks. Again, more glute work. Those lateral banded walks they really work my glutes very well. So highly recommend that one. And I just went and got those wider fabric bands instead of the plastic or the rubbery bands. I find it just helps really well. It just works well with these kind of the banded walks. So that's it in terms of update this week. Thanks very much. Really excited to create, updates, following updates to see how I'm doing. As always, want to give a shout out to the team at the Ottawa Chiropractic and Natural Health Center, which is the clinic of Dr. Zielonka here in Ottawa. They're the only clinic in the Ottawa area that can do the robotic laser spinal decompression. So if that's of interest to you, please seek them out. Great team there. And yeah, it's been working for me. So really excited to see how the next couple of weeks go. I'm just over the 50% mark. So I'm really encouraged that by the time I get through all this, sciatic pain will be a thing of the past. Any of that remaining sciatic nerve adhesions probably gone is my hope. And yeah, if I can improve the hip mobility and hip strength, that should work well for my golf game too. So hope you have a healthy and happy week, and I'll see you in the next video.